So those
Thank
are all
you.
the speakers that we have. I wasn't sure if some people had some questions that they wanted to ask, or maybe Michael hasn't chatted for a little while. Michael, uh, maybe you could give us a few thoughts while some people are thinking up some questions to ask.
Oh, careful there. Few
I knew
thoughts.
you, but you're always good. Yeah, that's my bailout.
Well, yeah, thanks to Shar and Sarah for sure. I feel your pain, and I'm not the only one here who's watched a preventable tragedy on a mass scale unfold, and those in direct service, in the shelter or on the street, that kind of work. I mean, as far back as 2016, we asked the Ministry of Health and long-term care for support resources because the train had left the station at that point, and it showed no signs of getting better, which it has not. And so, I firmly reject a structure and a system that actively injures some of our most talented people doing outreach and working in the shelter system. And for what, right? We're back to politics. Like what? Anyway, I could go on and on. So it's heartbreaking, and my heart goes out to them for sure. And those are my quick thoughts. So yeah, thank you,
Well,
Shar.
let me ask you this. I touched on the phrase community led. What if we're going to see something happen in the community? Obviously everyone wants to see something happen. Um, what level? I mean, it's a group effort? How does that group effort happen? Is it's a community led effort? What are we talking about here? I know we're not going to get the answer to this tonight, but just sort of start to push that snowball down the hill a little bit here.
Yeah, I mean, I think we had a really good the first go around with the Waterloo Region Integrated Drug Strategy. I mean, I helped lead it, but it was a bit of a model for other communities. We took our time. We took 2.5 years to do it. We had a task force of 26 people, and they met for minimum 3 hours every month and came up with 99 recommendations. And I think it was the process. It wasn't just about getting a bunch of words, to Sarah's point, 10 points on a piece of paper, or 99 in this case, and then calling it a day. It was the process that really matters, and I think that's often lost in not necessarily intentionally in government and in civil service, for example. And when you can't come through the other side, then it's equal attention to every voice. So you may be the chief of police or the medical officer of health or the ED of an agency. I'm just naming some positions. But your voice really matters as much as Shar, who, as far as I know, is not police chief, or Sarah, or any of the other people on this call. And sometimes that goes really well, and sometimes it does not go well. And I don't mean, I'm not throwing shade on those particular positions or those agencies, but there's a real command and control, a need to control the process rather than letting it evolve kind of organically, and certainly not hierarchically. And partly how you do that is ensure that those uh, most affected by this crisis, people who use substances, people who used to use substances, families and others, are present at the table. I mean, and we're accommodating those folks in new ways, because you might not have a home, or you might not have a cell phone, you might not have access to a computer, you might not have a dollar in your pocket. So the process really matters. It's a bit of a skill, more in the realm of community psychology, but it's totally doable. And you know when we actually started this thing called the Drug Strategy Network of Ontario back in a church basement in 2008, and those were, with the exception of Toronto Public Health, which has always been exemplary, that they were largely community-based strategies at that time. Since then, it's grown into more communities, but what has happened is they've largely been taken over or controlled by public health and or police and or maybe other big money type interests. And again, I'm not throwing shade on those particular sectors, but you get a different outcome, right? Jeff mentioned inhalation as a leading cause of death and mortality, and not just recently. Why don't we have inhalation facility, just to pick one example. Well, it's political, right? And it's not a conflict with the Smoke Free Ontario Act. It's the government of the day, and really the one before them too, to be fair, simply doesn't support it. What are we talking about here? A table, a chair, and a $15,000 fan unit or a porch outside.
Right.
Like that is political, and that has an impact, the kind of impacts that Char and Sarah are talking about. It's that steady stream of
Yeah.
death.
So, okay, Michael, let me do this. Take a look at, there's a question from Danica Fry in the chat. So we're going to pause with you, and I'm going to go over to Jeff for a sec, who has his hand up, and I'm sure he wants to comment, Jeff, on what you heard there. But I also want someone to just mention something, and I referenced it in terms of Sarah, the drug action team, just to let people know what that is as well. But go ahead, Jeff, and then I'll come to you, Joe, from Cambridge.
Yeah, thanks. Yeah, just kind of building off what Michael was saying there around how these things become politicized and what community-led means. And one thing that I think has is quite unfortunate is there are certain issues where for some reason everyone seems to think they're an expert. And part of this is kind of like this democracy where everyone should have a say in everything. But like, name any other health intervention where you need to have so many community consultations, you need to do like a number of evaluations, you need to just waste so much time to implement something that is life-saving. That happens for zero health interventions aside from ones that are for those most vulnerable in our society. So and it's not just thinking about CTS, it's also where are people going to be housed, right? And so, you know, this happens all the time. And I think, so when I think about community-led, I don't think about that. I don't think that community-led needs to be, we need to consult everybody who lives in this community. No, we need to consult experts. So we need to consult people with lived experience,
right,
people who work on the front lines, et cetera. Like, these are the experts. I don't want to go to an engineer to tell me their opinion about something that's not about engineering. That's, and I'll just stop there.
Okay, can you just give us a brief on drug action team and what that is?
Are you asking me or Sarah?
I could ask Sarah. Sure. Sarah, do you want to comment on just to let people know what the drug action team is about?
Jeff, you're already going. Go, Jeff.
No,
Well,
Jeff...
I'm the newest one here. I mean, I guess I'll say what it looks like for me as an outsider.
Okay.
So essentially, I moved here, as I mentioned before, I moved here in September. I know Michael through some national organizing. And really, I was looking for like-minded people. And so the drug action team is really made up of some people from the Waterloo Region Crime Prevention Council. And essentially we want to, and we're working on actionable items. Like, we need to stop sitting on our hands and talking about things. We actually want to advance things. And so one of the first things that we worked on since my arrival anyway, and Michael and others could talk about things prior to me being here, is around de facto decriminalization. Has it happened? No. Have we started getting the ball rolling? Absolutely. And so I think, you know, I'm a really action-oriented person. And so similar to what I was presenting and what Michael was saying is like, yes, we've known smoking has been a driver of overdose deaths for a number of years. And still there's literally nothing being done to address it. I don't know why.
Right.
So those are the kinds of things that we want to work on.
Okay. And so Sarah, then if you could follow up, and I know in the chat line, you know, there's a lot of people similar to the conversation you and I had with another politician not too long ago. There's a desire to do something locally. You know, everyone wants to do something. We want to do something. We got to do something now. I don't know. It doesn't seem to be a now thing. It seems to be an evolutionary thing. But from a local perspective, is the drug action team something that people can tune into or tap into to try to be part of a local grassroots movement? I don't know if that's correct or not, but you tell us.
Yeah, I think just right now we're gonna get ready to debut the website, and the website will have information, local research, local data in stories that you can connect with, so that you can have that local perspective. And again, like Jeff said, the intent is actually to bring some real changes to policies, so that we are going to be changing that system that is creating such an injustice life for many of our folks, and that injustice is what's causing the pain and the harm, and we know that now. So this group is meant to do actionable items, and we can get going and changing some policies, so we can actually do some real life implemented changes.
So people can watch for that going
Mhm.
forward. I see Joe from Cambridge today, I believe, has his hand up. Joe, did you have a comment or a question?
Yeah, can you hear me?
Yes.
Perfect. Yeah, this is for Michael. I'm just kind of wondering, when we look at the real absence of strategy in the hyperpolitical and politics surrounding kind of treatment and care, how can this kind of correlate to Cambridge in the CTS opening up here in the city? I know it's kind of been a multi-year process, but I'm just kind of wondering, how can that politics, or how does that kind of play into getting that set up here in the city?
Oh, well, it's a great question, Joe. And you're right, it's hyper political in Cambridge, over a table, a chair, and a set of eyes, right? I mean, it shouldn't be that way. So, but it's not just Cambridge, and even communities who have gone through that process, and sometimes it's quite divisive. Um, I mean, they've got applications sitting with the Ontario Ministry for more than a year, 18 months now, right? Just sitting and waiting, and in the meantime, to count the bodies, I guess. It would be my so to step back really quickly here, it would be, I don't know, 6, 7 years ago, I was presenting to the Federation of Canadian Municipalities on this very topic, and suggested that the absence of leadership at senior levels of government would mean these issues would end up in local municipal council chambers, precisely where they do not belong. I mean, this is sort of speaking to what Jeff has said earlier. Like, why are we talking about health interventions at a municipal council, for heaven's sakes, or clinical interventions in a legislature or the House of Commons, and to step just a little further back, after SARS one happened in 03, 44 people died across Canada total. It was an emergency response, and certainly we don't see that with the overdose crisis for sure. But out of all those commissions, the Naylor Commission, for example, the recommendation was remove the politics from the science of public health, and you'll get better outcomes. And that's how things like, the Public Health Agency of Canada was established, with a $700 million budget and a mandate to, and I quote, anticipate and respond effectively to emerging public health threats. And on this crisis, they've done nothing. And so if you notice, the federal data the national data only really begins in 2016. And it was 7 years of advocacy to get the feds to count the dead bodies. I mean, that was a struggle. So point is, it should never have ended up this plethora of issues in local municipal council chambers. It's unfair to elected officials and others. But here we are. And Cambridge is not the only town to be torn apart about debates. And to Jeff's point again, you've got everyone coming out of the woodwork to weigh in on a table, a chair, and a set of eyes in this particular case. And it's unfortunate. And in the meantime, like people are dying, and people are, I've put up, overdose deaths, just the raw numbers there. What I didn't talk about is injuries due to non-fatal overdoses. We think it's significant. 10 to 1, says Char and Sarah and other people doing outreach have seen those injuries. We think the rate, I mean, we're not really counting that either, but we think the rate might be in the order of 20 to 30 times the number of fatal overdoses. So I think 600 overdoses. I mean, it's a lot of non-fatals and a lot of injuries that now is an additional pressure on our health system, on our on people in direct service. So,
So
I don't. Go ahead.
yeah, so Michael, I just I saw Mike Maurice was kind enough to post something, and maybe Jeff, this might be something you could comment on. And it's, with respect to local control, and Mike pointed out one option, advocating for a local municipality to request an exemption from Health Canada for decriminalizing personal possession for people who use drugs, like the city of Toronto already has. Can you comment on that, Jeff?
Yeah, I mean, I think we're just doing a lot of waiting at this point. I mean, there's been asks done to the municipal governments over a year ago, prior to my time here, letters sent that just sit there and do nothing. And so,
Well, not that part. Actually, I wasn't thinking that part of it, although I appreciate the frustration there. I was thinking more, what's the effectiveness of actually that happening? City of Toronto, that process.
I mean, who knows, right? Things happen at a snail's pace similarly there. And I would say that what is actually needed, and I think one of the things that's a risk here is Toronto does it, and then everyone else says, let's wait and see what happens in Toronto. Well, is Toronto the same thing as Wilmot? No. Is Toronto the same place as Kitchener? No. And so again, this is the case for almost all policy in Ontario. Like, everything revolves around Toronto. We know this in education. My parents are both teachers. They're always talking about always trying to implement these new policies that aren't applicable to the rural town that I grew up in, right? And so, we see this all the time. And so great that they've applied, but I don't know, through the drug action team, we've come up with ways where we don't have to apply. And so this is the whole de facto decriminalization, right? Don't need to apply for anything. You just need a directive from your chief of police, right?
And when you say directive, they're saying they're not going to charge for certain levels of possession.
Yeah. Yes. And I know, at the local level, the communication around this has been oh, well, we've cut our charges in half and 50% by 50% in the last couple of years, which sounds like a great pat on the back, but at the same time, one person is charged in Waterloo region every single day. Why? I don't know. And so, really need to be having these tough conversations, although it's, it's a bit weird because people at higher levels are saying, oh, we all support decriminalization, but here's an option that's so readily available. And yet it's oh, let's have some more meetings and consult the community about this. And
I
Sarah
understand.
should jump in.
Well, and it's one of these options that, I mean, we've already, I think all of us have mentioned that these options, these drug policies, should not be about feeling emotional or beliefs. And here we are coming up with hypothetical scenarios. If we change this law, this may potentially happen, this could happen. We are comparing hypothetical scenarios with real life death. These things are actually happening right now to people. Injustices, violence, crime, death, illness is occurring this very second. And we are wasting time talking about hypotheticals that are very, very statistically low. Now, there needs to be two groups of us then. We need a group that can go ahead and start working on those policy changes. And then there may be a group that we can sit and chat and validate the concerns of the rest of the community. If you are really concerned that somebody's going to be urinating at your front lawn as they're exiting the CTS or they're leaving some clinic, then let's talk about that. Let's really talk about that. And let me explain to you, we can't control all behavior, but we'll talk about what being a good neighbor means. If your clinic is here, if you're visiting this block, if you're coming into this neighborhood, you are a member, you're a neighbor. And so let's talk about what that looks like, because we can create connection as well.
Yeah. Shar, you have your hand up, and then Kathy, I'm going to come to you after.
Another thing that I want to say now is CTS also has a program called WINS, which is people that are either using or have been using in their past. And they go around and they pick up like needles that are left behind, and they pick up garbage from supplies and stuff. That program is amazing. I know so many people that work on that program, and it's boosted their confidence. They have smiles on their face. I worked on that program when it first started. It was free, and people are they're thankful and they're thanking them. And when they come back to CTS, if I'm at Social Development Center, I'll like go over and I'll talk to them because I talk to everybody, and they're like, "Oh, so and so said hi," and they thanked us for doing it. And I noticed that a lot of people, especially around like the parks, any park area, or they're so thankful, they're happy. And I just wish that more programs like this could happen. Like
Right.
like with the whole security guards everywhere. Well, I'm not saying that sometimes there doesn't need to be a security guard, but why can't we do kind of the same kind of program where it's people from one of the encampments that are protecting their own stuff, right? They get paid, they know what they're looking after. They're already a group of people, they're already a community. So keep it in the community. They feel safer that way,
Right.
right? So
Yes.
I believe that we could do more programs like WINS with different areas of like encampments and stuff like that as well.
It sounds like we need good acronyms for good programs, but that's an excellent example of how, as Sarah said, is a community concern about what's going on in the neighborhood, and it's the people themselves that are participating, and it just builds goodwill amongst everyone else and brings down that stigma as well. I
Yeah.
would say, Kathy, over to you.
You gave me a perfect segue because I think as long as politicians are afraid that they will lose their office by making the choices that need to be made, I think we're going to continue to have these problems. And I really believe that we have to address the stigma. And as I said in my presentation, I think that starts with ourselves and looking at what we've been raised to believe about people who use substances and how and what's happened in our own lives about it. So that just encouraging people to have the courage to make the right decisions is so important. I was a cancer nurse, and what I see happening right now is like giving someone a little bit of chemotherapy because you'll feel like you're doing something, but we don't treat cancer with just a little bit of drugs. We take out we do whatever has to happen, and we use multiple drugs, and we fight it. So if we're really going to be serious about this, we have to educate our politicians, educate ourselves, educate the public about what's really going on, because I think that's what has to happen, and support the people who are right in the front lines. I mean, I think of things as simple as, it's been brought up already. What would it take for us to have an inhalation site at our CTS? What would it take for our CTSs to be open 24 hours? They're only open from 9 to 5. People don't just use drugs from 9 to 5. What would it take to do that? What would it take to create CTS sites that were mobile? We have the Sanguine van, we have the Sanguine programs, and doing a lot of support for people out in the community, and yet people in Wilmot and things like that don't have those services. So like, we are very smart people, we could be extremely creative, but the politics shuts us down because there's so much stigma. And when you see politicians promoting that kind of thinking, that we're enabling people if we give them supports, when really it costs us a lot more not to do these programs. I'm a nurse. The people who don't die cost a lot of money in our healthcare system. So I keep saying, if you can't do it because people are going to die and their families are going to be devastated, then do it because it's going to save money to do the right thing. And there's a lot of cost when people die too. I was off work for many months after my son died. So the loss of activity, not just for the loss of the potential in future, these are young people that are dying. A lot of young people are dying, that they need to their families are also, the productivity of their families is gone when they die. The productivity of people in supporting them with safe supply and decriminalizing possession, et cetera, so that they can get jobs. It's costing us so much financially, as well as emotionally, physically, you know, in every way. So I think addressing stigma is a big part of it. And we do that by educating ourselves and saying this is a human issue.
Yes, it seems that's a great point. It just got me thinking stigma not only for the community, but stigma for the politicians to recognize that we need to put more money into this to try to make things better. It's that stigma of where you're investing your funding, and if it's perceived as enabling or has that thought about enabling, we have to overcome that and just we have to do what we need to do. Just as Jeff mentioned earlier, you know, any other health crisis, we don't sit around deciding whether we should put the money into it or not. You get in there and do it. We're not doing it when it comes to drugs. And that's why, and now we have a crisis. So it's like everyone acknowledges there's a crisis, but we're not committing the funding to what we need to do.
It would
Or
be
come up with
like,
a plan.
you know, there's those fires going on in Nova Scotia right now. It would be like going in with a bunch of buckets and saying, well, we're doing something.
Right.
Because it would not be popular. I think there has to be an integrated strategy where, you know, I'm all for decriminalization, but if you only do decriminalization, but you don't have safe supply, so what they have in their pocket that they're not going to get put in prison for could kill them anyway because it's poisonous. So it's like it can't be piecemeal. It has to be,
Right,
you have to
right.
look at the whole enchilada. You know?
And we have enough information to know to do all that. Sarah, do you want to jump in
Yeah,
there?
just really quick, because we're at the point now where we're going to need a whole bunch of different programs that are going to tackle drug use, trauma, harms, all kinds of different harms in all kinds of different ways. What we really need, like, because we're trying to support the folks who are now adults struggling and in pain, trying to figure out and soothe and create safety for themselves, when really we should be looking. So if we want to prevent this 37-year-old from experiencing that pain and that trauma, we need to have a look at that young mom. Is she getting enough nutrition? Is she safe at home? Is she going to be okay once that baby is born? Are they going to be able to afford healthy, safe home and nutrition? Are they going to be safe in school? That's what we're talking about when we talk about upstream. Are all those systems actually supported and properly financially supported? Are we making those commitments now so that 37-year-old is healthy and happy and productive whenever they get to that age, right? That's what we need to talk about. What do those systems look like?
Yeah, I agree with you I agree with you. You know, upstream, what is upstream? How do we fund upstream? What are we targeting with upstream? And how that all, it needs to be viewed as a integrated process. And certainly, you know, I was going to ask about what upstream meant, sort of define that. Maybe Michael can touch on that in a second, but Shar, you wanted to say something.
Yeah. Well, I was at the rally on the weekend for the 24-hour rally, and I heard Jamie say what she was trying to explain upstream to somebody that was asking questions, and she said it the best way I've ever heard it. She's like, it's like a stream and somebody keeps falling in, but they don't know how they're falling in, so they're slipping. So somebody goes far ahead of them and figures out why they keep falling in, right? So then the next time the person falls in, there's somebody there to catch them, right? So upstream is the workers are ahead trying to figure out what the problems are, even though we all already know what the problems are. And then by the time the participant catches up to us, we're ready for it. So that's how, that's like
that's a great analogy, Shar. Good analogy. And Michael, what does upstream mean to you?
Oh, how long do you have, honestly? So it means a few things. And you know, almost anything is upstream from an emergency room bed, right? And notwithstanding genetics and disease and that kind of thing, but you know, most people who are going into hospital, those are avoidable. So somewhere upstream, and and you know, at the Crime Prevention Council, we would say, and that was really a body of expertise on prevention, and you know how that turned out. We would say that, you know, prevention begins in utero through the lifespan. And we would say that it includes, but it's much bigger than those structural determinants of health, into the kinds of things like culture. And so now we're into the realm of media, for example, into the realm of who makes decisions and how are decisions being made. Like, you know, I think if you had any intersection with drug related issues over the years, you've heard the phrase "nothing about us without us." You know, it comes out of the disability movement, and you know, from the '70s when people were designing, you know, accessible spaces, but actually, you know, had no experience or had ever talked to anyone in a wheelchair, for example. The same thing is true in drug related issues and more, right? So who's around the table and how decisions are being made is so key. And we would say, you know, you're hoping for, you have some objectives and maybe you achieve some outcomes, and maybe they're even like structural in nature, you know, like bigger things, you know, income equality or universal access to healthcare, for example, etc. But how you get there is sort of the software of the operating system, and that process is so is upstream, right? And that's why I worry about culture. That's why I mentioned this drift, not just south of the border. I mean, we've seen it locally. It's George Orwell's 1984. Like it's here, and that erodes trust, of course, creates confusion, and it creates divisiveness where it's increasingly hard to find the sweet spot in the middle. You know, the middle path, where two, you know, two people or two entities with different opinions can get together and have a reasonable conversation. So we've seen upstream being thrown around, and it's almost become meaningless at the local level, and beyond. You know, so yeah, I should stop there. I mean, this is the stuff of a longer conversation for sure, but that's why I'm sort of big on community-led process, and that's a real challenge for government, right? I mean, the hardest thing I think, in my experience, is for government to give up control, to trust community, to trust the residents, that the civil service and or elected officials purport to serve. I mean, it happens sometimes on a small scale, but by and large, when it
Right.
comes to resources and power, it is so difficult. And yeah.
So now we've circled around to community led and the importance of listening to community voices. Unless anyone has anything else to add, I was just going to sort of wrap it up at this point. And on that concept of community led and trust that you mentioned, interestingly, I just came across a book by former Governor General entitled Trust. So I thought I'll take a quick read through that and see. And there's, you know, first concept, the first issue was transparency. But what I wanted to say was I really appreciate the opportunity for you all to share your voices. And I know this is not the only time that, or only platform that you'll be doing that, because you do have, as was mentioned, the drug action team. And I look forward to interacting with you on that and seeing more of what comes out of that. And I'll also be using this platform for further conversations, to talk about other aspects and to take this into other areas for the community to hear what's going on, because I think transparency is key. The sharing of information is key. It leads to a better common understanding of what it is we need to do as a community, and hopefully knock down some of those silos that get built up and are a barrier to community action. And really, there shouldn't be these silos. There shouldn't be these protective turfs, because there is one common goal that we all want to share, which is, you know, betterment of our fellow man and woman. And that is really what the goal at the end of the day should be. How do we lift up our brothers and sisters and treat everyone as we want to be treated ourselves? And sort of that common principle should really be the guiding principle, I feel, in terms of moving forward. So I just want to thank all of you for sharing your thoughts with us. It was a great conversation. and I know we'll have more of them. So thanks to all of you for being part of this tonight. Really, really appreciate it.
Thanks for having us. It's an important conversation.
Yes, Kathy, thank you very much. Okay, and to all you participants, thank you very much. We will, on our website, there'll be a replay of this that you can share with anyone you want to. We will have also a written document from this session tonight that you will be able to take and share. And the whole idea is to get it out to as many people as possible. Take care, everyone. Good night.